So if you go and test for H3N2, you may just be burning a hole in your pocket. A test at a private facility may cost somewhere about rupees 6,000, and at a government facility this test may cost you around 2,000 rupees. And it doesn't make sense for you and me to do it.
Well, H3N2 is not the COVID. This is the first thing that we need to understand. It's just like any other. That 1 decade before we came across the H1N1, which was known as swine. So it is just like any other flu. This virus is not the COVID-19 virus. So we do not routinely, necessarily, mandatorily need to test ourselves for H3N.
Yes, there may be certain cases where testing is required. For example, somebody who's having very severe symptoms, somebody who's having some atypical symptoms, somebody who's immunocompromised and where we feel that he's a high risk person for developing severe illness or complications. In those cases, yes. Sometimes some virus cause infection which are more laced with fever, high-grade fever. Somebody may have more upper respiratory symptoms of runny nose, sneezing, nasal blockage. This time, the most common feature that we are seeing is a fever of 1 or 2 days, which then subsides, and there are some upper respiratory symptoms or catarrh, runny nose, maybe some sore throats. And then after that, when all these also subside, there is a bit of lingering and persistent dry type of a cough which is there.
People have been saying that many of them are being recommended excessive use of antibiotics. Some are self-ingesting antibiotics. Doctors say that this is not good for the individual. Anyways, antibiotics do not play a major role in curing viral illnesses. Most of these are self-limiting and will leave your body in a few days or weeks.
Indiscriminate use of antibiotics in any setting has to be discouraged, and antibiotics do not have a place in the treatment of viral infections per se, unless the clinician feels that person is getting secondarily infected by bacteria.
You can take a paracetamol or any generic medicine to cure your fever. Steaming and inhalation is going to be beneficial for the patient. And also, if you experience heavy chest congestion, you must go and visit a doctor who would most likely advise you to then get hospitalized.
There is no specific treatment for this particular H3N2. That is again the bottom line. So we don't have, so mostly it is by supportive care, the general antipyretics, analgesics, local therapies which are given. We do not have any absolute specific therapy for H3N2 influenza per se.
For more informative videos like this, keep watching India Today News Mo.